for all of you for being here. So I'm Guillaume Bernard. I'm a project manager at LNE. LNE is the National Laboratory of Metrology and Testing in France. And so I will try my best to present you the services offer that we provide through the TEF-Health project. So, for a little bit of context, the LNE is a French institution born at the beginning of the 20th century, and we are owned partially by the French government, meaning that we have both public mission, but also mission from the private sector. And we provide services, prestation, if you want, generally not only in AI in the healthcare domain, in metrology, testing beds, certification, and we also provide a bit of training for the industry to help them improve in all of the matter regarding this mission. My department is the Department of AI Evaluation and also Cybersecurity, created in 2008. We are located in Trappes in France. Trappes is a town near Versailles, if you know. And we have been at first working mainly on natural language processing in the natural language processing domain, but since then we have been applying our methodology in many different domains, such as the healthcare domain, obviously. And we provide, for instance, datasets analysis, AI testings, or regulatory analysis. So, regarding all of our work, what problem do we try to solve for SME in the TEF-Health project and through our services offer? So, what we want to do is to help SMEs to prepare as best as possible for the application of the Act, and also to help them identify what they need to achieve and to reach the CE marking, what they could lack, what are already the strong point, and so on. So our services offer could be split into 4 main categories, and in the next slides, I will show you in more detail what type of services we provide. So, for instance, we provide regulatory gap analysis. So we compare the current state of your process, of your documentation, and so on, against the articles, and especially the articles of high risk for the high risk AI high risk systems, and the requirements. We also help you understand the technical, more specifically, the technical documentation requirement, especially those that are stated in Article 11 and Annex 4 of the AI Act. So there is a list of documentation, and we compare that to your own documentation, and we try to see what is lacking, what could be improved, and so on. We also provide services around the quality of your data set. So all of the data sets that you use to train or evaluate your AI, and based on the requirement in the Article 10 of the Act, we ensure that you have the correct level of quality, whether it is through the bias identification, the representativeness of data, and so on. And finally, we also help you evaluate the behavior of your AI system, whether it is the performance, the robustness, and so on. And it's directly linked to Article 15 of the AI Act. So if we go in more details on the services, we choose to split it into 3 main parts that you see are linked. So it gave some kind of logic from one part to another. First, the consulting services with the regulatory gap analysis and the analysis of your process. Then we have the more focused services more focused on the data sets with the assessment of the quality. So I already explained that, but the bias identification, the analysis of influence factors, so the features in your data that have an impact on your system, the representativeness of data set. And finally, the last part, the testing services. So we develop an evaluation method for the AI solution. So through the evaluation plan, a document that is really important to define your testing protocol, and that can be especially important regarding traceability and repeatability requirements in the Act. So for instance, in the document, you have inputs, output, evaluation metrics, and so on. And from there, we, if the SMEs of course choose, we can provide the performance evaluation, the robustness evaluation, or the resilience evaluation, depending on the need of the SME. So this slides show a kind of logic between each main categories, but obviously the SMEs can choose only one services, and that's all. So regarding the business value for SMEs, what is the benefit for you? It allows you especially to prepare earlier for the CE marking, saving both time and money, meaning that for the healthcare domain, especially in the medical device domain, since it's already highly regulated domain, the AI Act will only be applied in 2026. But it doesn't mean that you must wait for the date. You need to already work on it to identify which area of your processes, of your management system, you must improve to be ready for the application of the AI Act. And also, we provide through the services an unbiased evaluation. Often inside the SMEs, you have expertise on the evaluation, but it's not your job. We at LNE, we are evaluator, and also it's always helpful to have an outside view of your systems to better analyze it and evaluate it. These services have also been developed based on both AI Act requirements and feedback from the notified body, so we ensure that services output will help the SMEs answering the requirement from both. So an example, more practical example of two services that are currently provided. So it's for French SMEs, Median Technologies. They want to commercialize in Europe a medical device that use AI, and this AI system allow to identify and characterize the malignancy of nodules by using MRI images. So Median comes to us, they had the need, they wanted to prepare for the clinical validation and the obtention of CE marking. And through several meetings and discussion, their main objective was to ensure the quality of their AI system and to be sure that it's respect of the regulatory requirements. And through this discussion, we decided that these two services were the most relevant for their needs. So first, a more consulting services one, where we do analyze their quality management system, their documentation, their processes. And the second service is an AI performance evaluation using datasets, which also includes an evaluation dataset qualification, so another services that you can take alone. And with this, we evaluate the data, we qualify the dataset, and using the dataset, we evaluate the system with metrics and so on. And at the end, we give a report with all the evaluation results. And if we want to go one step beyond and to think a little more about integration between all of the partners from the consortium, because it's also one of the main points of the TEF-Healthcare project, it's not only, you do not only contact one partners, but a network of partners depending of your needs. If we take the same need for an SMEs, we have the first services provided, for instance, by LNEs, that is the analysis of the AI development and evaluation process. And after the conclusion of these first services, we have two conclusions. We see two points that are lacking regarding the requirements and the regulation. The evaluation dataset is not representative enough. So we use two services from the hospital partners that can provide data, qualified data for the needs of the SMEs. And then, since the evaluation protocol is also to be improved by using the dataset, we provide another AI performance evaluation using dataset by other partners, for instance, from Bratislava or Polimi. And finally, with the conclusion of this evaluation services, we see that AI cybersecurity also need to be tested and evaluated, and we go to the fourth services provided by CETIC, and Maher and Nikolaus will go into more details after that, which is a vulnerability scanning and penetration testing. So last slide. Seeing that, how can you engage with us? So Petra already showed a little the website, but you go on the following link, so tefhealth.eu. You click on the search for services button that is at the beginning of the page. And then once on the catalog, you filter the categories here, a little dark, sorry, the category per organization, you choose France, and in the country filter, and finally you choose the Laboratoire National de Métrologie et d'Essai, the LNE, and you will have access to the list of services. Finally, so if you have any question on the services after this webinar, please feel free to contact me. Also, there is an ongoing call in which you can apply to access the services of all the consortium, but CETIC will do a more detailed presentation on that. That's all for me. Thank you for your attention, and I will answer your question after CETIC presentation.